Thank you, Chairman. We discussed HB 491 last week in the public hearing. I moved the table report today.
What about your amendment?
I don't have an amendment.
Representative Hall?
What is
I think Representative Hall will address that amendment for us. That was her amendment, I believe.
Yes, thank you, Madam Chair. I you have an amendment before you. If you would go to page 4 after line 5, I mentioned this on last week as we were meeting. After line 5, you would insert the following new subdivision, so you have a subdivision 5, and it would say notice of objection that a sign or signs which contain the required notice specified in subsection F of section 4 is posted in a clearly visible location near the entrance and in close proximity to the sign-in area where a patient enters for healthcare services. And you know, as I've gone back and studied this bill and read this bill and looked at what has happened in other states, even such as Indiana, that I think it is important for individuals to know. They should have a right to know as they enter that particular health facility that they notice that that objection is that an individual who may be the provider for the services to them may object to that. So if you read through on page 4, line 26, after writing, you put, and has complied with the requirement to post a notice of objection. And then after writing also, and complying with the notice of objection. So that is the amendment, and I would move for adoption of the amendment.
I will second that, but mine is
I don't have that.
There are actually 2 amendments. The first one was on top of your bill in your packet, the second one was on the bottom.
I'm sorry, I was not aware of it.
And I'm wrong.
I did
There was
get-
a so that was to be added.
We'll
for a
address that one
technical-
I was gonna make that
It
motion,
was a
that's,
technical amendment.
So we're on the longer
we're gonna make
amendment.
Mary Hall.
Representative Hall.
So I move the adoption of the amendment as presented.
second.
Okay, Representative Mooney?
I appreciate Ms. Hall thoughtfully looking at the bill. I moved to lay that amendment on the table because the purpose of this bill was to provide an opportunity for people to express their conscience in relation to procedures such as may violate that conscience. By posting signage in areas that would be such as hospitals or clinics or other things that become confusing and I think in many ways defeat the purpose of the process because there are in those facilities people who would provide services that are legal and acceptable. It does not affect abortion clinics, so it would not affect them. Quite honestly, it, I think, encumbers hospitals and clinics with something that's inappropriate in the process. We're trying to provide a lack of conflict, not create conflict. So I move to lay that motion on the table.
I would ask you to vote no.
So if you are voting, your motion is to table the bill with Representative Mooney, your vote would be
The amendment.
to amendment, yes, and if you want to add it.
A roll call.
I second.
Was there a second to lay the motion on?
I'll second the motion to table.
Yeah. Well, I didn't second the table, I second that.
And I request a roll call vote.
Representative Hall has requested roll call vote.
A yes vote is to lay it on the table.
Yes.
That's correct.
Ms. Weaver,
Yes.
Mr. Milliken, Mr. Knight,
No.
Ms. Beach, Mr. Friday,
Yes.
Ms. Hall,
No.
Mr. Johnson,
Aye.
Mr. Lee,
Yes.
Mr. Mooney,
Yes.
Ms. Nordgren,
Yes.
Mr. Patterson,
Yes.
Ms. Warren,
No.
Mr. Williams.
Yes.
You said the bill is laid on the table.
I would move that the technical
The
amendment.
amendment, yes, the
I would
amendment.
move that the technical amendment.
I'm sorry, the amendment is tabled.
I like that suggestion.
Yes.
I would move now that we add the technical amendment, the word so.
And there was also the technical amendment in your packet.
Second.
The technical amendment, after failure to do, insert the following, so. Motion made by Representative Moody, seconded by Representative Lee. All in favor for adopting this amendment, say aye.
Aye.
Any opposed? The amendment is adopted.
Move for a favorable report as amended.
Second.
Move for favorable report as amended by Representative Lee, second by Representative Friday. All in favor, say aye.
Aye.
Any opposed?
No.
The ayes have it, bill is in passage, as amended.